This presentation is by Robin Alexander, Karina Torres, Andrea Vargas, and Nyosha Hamilton. Our subject is new birth control technologies. How does birth control affect the population? Birth control can affect a lot of things by preventing unsafe abortions, by reducing unplanned pregnancies. It can prevent maternal death by preventing pregnancies those at high risk. It can improve child survival by lengthening the time between pregnancies. It also prevents early birth, low birth weight, and death of infants by avoiding early teenage pregnancies. Also, financially, birth control can increase economic growth due to fewer dependent children. Reproductive health considers contraception. Apparently, 85 out of 100 fertile women will become pregnant within 1 year if they are sexually active and use no birth control. Birth control are conceptions and the use of devices or practices that work against concept, which can prevent the union of sperm and an egg.
There are several different options for females for birth control. There's abstinence, barrier methods such as sponges, diaphragms, cervical caps, female condoms, hormonal methods such as pills, oral contraceptives, the patch, shot injections, and vaginal rings. Also, there's implantable devices, permanent birth control methods, and emergency contraception. The contraceptive sponge is a barrier method. It's a soft disc-like device that includes spermicide. It contains spermicide, which kills sperm. This is used inside the vagina and it's effective up to 24 hours, and it needs to be left in at least 6 hours after having sex. And the only kind of contraceptive sponge that is sold in the United States is only one. It's called Today's Sponge.
Birth control patch is a transdermal patch applied to the skin that releases synthetic estrogen and proestrogen hormones to prevent pregnancy.
They aim to take the egg from releasing the egg. And the pill also causes the lining of the uterus and the cervical mucus to keep the sperm from joining the egg. With this pill, women usually have periods 3 to 4 times a year.
There are many different ways where you can prevent pregnancy. One of the ways is the vaginal ring. The vaginal ring is a very thin, transparent, flexible ring that you can insert to the vaginal, and you can do it yourself at home. This provides contraception protection. You may leave the ring in for 3 weeks while it slowly releases estrogen and progestin hormones in the body. Contraceptive effectiveness. About 68% of women in the U.S. are at risk of unintended pregnancies who use some kind of method of birth control. According to some researchers, women who use contraceptive correctly have a more effective way to prevent pregnancies. You can either do the injection or the implant method. The birth control shot is an injection of hormone that prevent pregnancies, and you need to get this shot every 3 months in order to make sure you prevent pregnancy.
This rod releases progestin, which causes changes in the lining of the uterus and the cervical mucus to keep the sperm from joining an egg. It is effective up to 3 years.
The IUD method. There are 2 types of IUD in the United States. There is copper and there is hormonal. It's a T-shaped device made of flexible plastic where you insert into the vaginal. Either a local health provider can provide you with this, and this is one of the ways that one of the options you can use to prevent pregnancy.
According to the 2013 American College of Nurse and Midwives, the most popular birth control methods is birth control pills, with the least favorite being cervical cap and diaphragm.
Moving on to newer male contraceptives, with technology advancing.
Some alternative methods for men also include the clean sheet pill and ultrasound treatments. The clean sheet pill has no release date and the research is not yet complete. This is a pill that essentially shuts off the muscles that eject the sperm and semen. By the male body not being able to eject semen, this would allow a huge reduction in HIV as well as birth rates. However, there is still a huge fund gap. About $300,000 is still needed to complete research. Ultrasound treatments are in the process of research. The University of North California is leading current research. This treatment is painless and about 15 minutes long. The effects would give approximately 6 months of contraceptive. However, after multiple treatments, the male can become permanently sterilized.